whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. Today we're talking with Dr. Carolyn Gérin-Lajoie. She's a bilingual psychiatrist and assistant professor in the University of Ottawa's Faculty of Medicine. She's worked at the Ottawa Hospital since 2000 in various leaderships, teaching, and clinical roles. She became the inaugural Medical Director of Physician Health and Wellness at the Ottawa Hospital, while also working as Director of the Faculty Wellness Program at Ottawa's Faculty of Medicine. In 2019, she joined the Canadian Medical Association as the first Vice President of Physician Health and Wellness. Over the past 5 years, the CMA's Physician Wellness and Medical Culture team has grown to include 11 dedicated staff who work on physician wellness advocacy, measurement, solutions, and innovations. Dr. Gérin, thank you for joining us. I'm excited to learn a bit more about this elusive topic of wellness.
And thanks for having me.
So what is wellness? Let's back up a little bit. It's much talked about, but somewhat vaguely defined. Where do you even start when somebody asks you about what is wellness?
Well, I think you said it well. There isn't really one recognized or accepted definition. And the fact is, it's an evolving concept, which makes it super exciting. But there's a couple of definitions along the way that I've often referred to. One is an older one from the Lancet Journal in 2009. And that was from Dr. Jane Lemaire, one of our Canadian pioneers in wellness. And what she suggested as part of that article is that when we think about physician wellness, it's more than just the absence of illness, that it's really about physicians and learners thriving and succeeding both in their professional lives, but also in their personal lives. I really like that kind of basic approach. But one that has come later that is a bit more comprehensive is one that we find in the Canadian Medical Association's policy on physician health and wellness. And in that definition, what you see is emphasis on, we're talking about acute and chronic illness. We're talking about prevention and treatment. We're talking about making links to social, to spiritual, to physical dimensions. It highlights kind of a risk management approach and also a bit of an occupational health and safety lens. So that definition I found is much more comprehensive and brings in different elements of wellness. But maybe one key or nugget to remember when we talk about physician health and wellness, I would say it's to remember that it's an occupational hazard. Physician wellness is something that we need to think about in that context of workplace, of work conditions. And fact is, anyone working in healthcare, no matter what profession you're in, within it, is at risk because of the nature of the work. So those are the types of things as we relate to the concept. But what's interesting, we're saying, hey, this is a field that's evolving. I love to think about how that concept of physician wellness relates to different models or different frameworks that are out there already. And if I can mention a few, one of them is the triple aim. Now, some of you may not have heard about that, but the triple aim is really a performance measure that healthcare organizations use. It was proposed, I think, by IHI way back in 2007. And what the triple aim talks about is the combination of healthcare outcomes, of cost to the system, but then of patient experience. So that's how organizations were measuring their performance. But with more research linking clinician wellness with things like patient experience and health outcomes, they decided to add another component to the model, and then it evolved into what we hear more recently, that quadruple aim principle. And I think that was so important to highlight the importance of not just well-being of clinicians, but just that fulfillment, the piece where they feel that there's meaning in their work, that they're supported to do their work in treating and helping patients. So I think that was excellent. And that has now evolved even further, Jordan, you may know, into the quintuple aim, because we've now added health equity, which again, we know it really does feed in and improve those outcomes. So that's one model. that connects to physician wellness. The other model is the Stanford model of professional fulfillment. So it's interesting here. So they're connecting wellness to professional fulfillment. But the way they design their model is to say, for any organization that wants to improve physician wellness or staff wellness, you have to make sure that you provide a culture of wellness. That's one piece. Also, you have to make sure that there's support for individual resiliency. That's another. But the third one that's important is the workplace efficiency or efficiency of practice. And all of those three components go into enhancing professional fulfillment. So what's really interesting is when they've tried to tie in these different components with research to see what affects what they found is it's really through efficiency of practice that we can get the most benefit for wellness and professional fulfillment. So it tells us that that's where we need to start working if we want to improve wellness. So that's a model that some people are familiar with. And more recently, models such as Joy in Work, again, proposed by IHI, that is a white paper that proposes steps for organizations to take. Again, same idea that joy in work isn't necessarily the absence of burnout, but is really an approach that emphasizes the meaning at work, compassion at work, and the importance of support of the workforce in order to give, again, the best patient care possible. And the last piece I'll mention here, as we're talking about different concepts and how to position physician wellness, is the model of occupational health and safety. Workforce health and safety, and that applies to healthcare also. And so it's that mandate to really examine the risk factors, what are the hazards in the workplace, to ensure that all the workers can be at the best of their scope and do the job that they need to do. So I think that is a more recent lens that I'm finding very intriguing, and I think that applies really well to this concept of physician wellness.
So it very much relates to work and is a risk factor of the medical work environment, but there's a lot more going on there than just being the antonym to burnout, I guess. You mentioned a little bit about how the clinician is feeling, but also like the impacts downstream towards patients or even the team. Could you expand a little more on why focusing on wellness is so important? What is the other side of that coin when you're feeling unwell or burnt out, or however else you like to actually measure that?
Yeah, well, that's a great question. And, the start to that is to say one of the reasons why it's important is because the prevalence rates of the burnout piece is so high. And that's how we started talking about wellness or burnout as a burning platform or as almost an epidemic, just because of the rates that were coming out as 50% or higher burnout rates. And that's when it compared to the general population, it was higher, or compared to other really challenging professions, it was higher. Important to look at. But why is physician wellness important? It's because of the impact, as you've mentioned. If you just think of the impact on the individual physician, well, this is major suffering. They're suffering from stress, distress, burnout, which then makes them at risk to develop a continuum of different mental health and health issues. Physical ones as well, but mental health meaning anxiety symptoms, mood symptoms, substance use disorders, and really the worst case scenario, which is really tragic, is death by suicide. And of course, this all impacts their immediate family. So the individual physician is definitely impacted. But what's also interesting to consider is the impact that it has on patient care. So the research is now clearly linked physician burnout on decreased patient satisfaction, decreased patient care. It increases the risk of medical errors. It increases disruptive behavior. So if you examine just that piece, what it tells us is essentially physician wellness is a quality and safety issue because it is directly linked or impacts physician care or patient care, and also the risk of errors. But the other really interesting piece is how this all translates into cost to the system. So if you think of decreased productivity or issues with retention, when you think about just the cost of replacing a new physician in the system, all of that risk of or impact of medical errors, all of that translates into cost within the healthcare system. In the States, actually, they did a study. This is hard to study, actually, but they did it. And they estimated that in the US, when there were burned out or unwell physicians working, it led to a cost of $4.6 billion per year because of what we talked about, decreased productivity, retention, and so on. So that means we can also talk about physician wellness as a health system economics issue, as well as we said, an issue that is really close to safety, quality safety. And as we've said, it's an occupational hazard.
So certainly there's an economic argument to be made there. It sounds like the data is starting to support that. I think the younger generations of people in general are just being more in touch with, paying attention to their mental health and their well-being, and again, sort of that work-life balance aspect as well. Does the data show things getting better? It sounds like there's pretty high prevalence. Are things improving recently, or what's the actual trend been like?
Well, we did the CMA, a National Physician Health Survey, that was done first in 2017, and then the second one, the follow-up, was in 2021. And Jordan, it confirmed what we suspected, especially with the impact of the pandemic, that unfortunately there was a bigger impact on the health and wellness of physicians and learners, because this survey was done across Canada in all provinces, and it included not just practicing physicians, but also the learners. So we were able to get a sense there of how things were different. And what's alarming is that we found almost double the rate of burnout, high burnout, compared to the 2017 survey. So now we were seeing in 2021 rates of about 53% of physicians and learners reporting high burnout rates. But what's even more alarming, digging into some of those other health outcomes, is that almost 50% also screen positive in a depression question. About 25% also reported moderate to high levels of anxiety, and even suicidal ideation went up. So these are all alarming signs telling us that there is huge impact on the healthcare system pressures plus pandemic on the physicians and learners. So this is really important information that we need to continue tracking and continue measuring.
It'll be interesting to see how it plays out. Just anecdotally speaking to like my own patients that I see and their mental health, it seems like there has been an improvement. I would say noticeably over this last year, people are starting to socialize and feel less isolated, and depression and anxiety seem to improve. Do you think that's going to lag in the actual healthcare industry for the workers itself? Do you think it'll kind of keep up, or what's sort of your sense?
Well, it's interesting. I've not seen data yet to support or to give us a sense or a trend of improvement. And honestly, for us, the next survey is going to come out maybe in 2 years so that we can directly compare the measures. It's an interesting question, because when we speak to colleagues, to patients, to stakeholders, the distress continues, and I think the suffering continues. The pandemic, the worst phases may be over, but we are now still in a very real healthcare crisis with huge pressures. Family physicians are still really struggling at the moment. Administrative burden is higher than ever. We hear now about moral distress. So I'll be very curious to see if some of that is true, Jordan, in the research and in measurement. What is encouraging, however, is the interest and the concern that everyone is expressing now around physician wellness. I think what we're seeing now is collaboration, it's partnership, it's groups saying we need to do more than talk and acknowledge wellness. We need to actually move to action. And so there's been a big shift actually towards, and maybe that's where we feel a little bit more empowered, emboldened, is that we're finally at a phase where we're saying enough is enough. We need to work together to do something to improve wellness. So I'll be very curious to see, and I do hope that our results improve over time in the next National Physician Health Survey.
Fingers crossed. We'll see what the data shows. So you've had your finger on the pulse of just the wellness side of things, both in the hospital scenario and both in the like faculty of medicine and the teaching departments. How are things evolving over the years, in your time in this field? How have you seen things changing?
Yeah, and that's really been interesting for me to watch now that I'm working in the area for a few years. And many things have changed. When you think about the evolution of physician wellness, actually, uh, in the 1970s or 80s, the focus at that time was really about substance and disabled physicians or capacity of physicians. And so the treatments were completely focused on substance. Uh, and then over time, I'd say in the 80s or 90s, we saw the evolution of physician health programs. We saw that in the States and a bit in Canada, with a broadening of issues that we're focused on. So no longer just the substances, but it was really about, hey, we need to look at mood issues, anxiety, and other health issues. So we saw the expansion of physician health programs. And then what we saw later on is the inclusion of wellness programs in faculties of medicine. So in Ottawa, this began in about the year 98 to 2000. And then I'm pretty sure every university has now some version of a wellness program or robust wellness resources. So that's been a big evolution. And now what we're seeing is organizational wellness, right? Where organizations are now taking steps in their structure, in their leadership, in their policies and procedures to really make a difference in wellness. So that's been part of the evolution that I've seen. Going back to burnout is probably the first theme that was identified early on. Again, that's now expanded to a whole gamut of a variety of health issues that physicians face. And actually, I'll add not just mental health. What about physical health? There's a strain and there's MSK injuries that physicians experience. If you're a surgeon, if you're an obstetrician, just the years of certain movements or certain positions. What about exposure to violence? That is affecting health. What about fatigue relating to physical? So there's a whole gamut of health issues that physicians are facing. So a broader kind of appreciation of all of those elements. The other thing we saw, the expansion from not just treatment or the reactive component, but really proactive prevention, education around wellness, advocacy at the front end. There's programs like WellDoc Alberta, actually, that in the last 5 years have really created a program that's a collaborative where they're working on that proactive angle to educate, to teach about physician wellness literacy, about measures, how to engage leaders in taking on work to improve certain pain points with their staff, with their teams, and then measure and track some of those initiatives to see what difference it makes. So that's been just one example of a group really focusing on the proactive approach. And I'll have to say as well that the physician health programs, beyond just treating when there's illness and clinical disorders, they've also been stretching to include also some prevention and some education. So that's been a shift. So those are the things I would say. And again, the really emergence of the leadership role in wellness. So, you started seeing across organizations some wellness champions, advocates. And that's become more formalized. We now have formal leadership positions in health and wellness. We've got training programs in the States. There's probably the more recognized one is the Chief Wellness Officer course from Stanford, with a very robust training program to become a wellness leader. But there's other opportunities for training in Canada as well. Canadian Medical Association, through their physician learning program, also there's a module on the basics of physician wellness, but there's also a trauma-informed leadership course. There may be other courses more focused now on wellness or safety. So more to come, but I think of two groups that could benefit from that leadership training. There's the wellness champion or leader that would definitely benefit from the core leadership skills. But I also think of any healthcare leader or administrator that would benefit from learning about physician wellness, certain skills, certain with the evidence, the literature. So the return on investment, so to speak, the why. So I think there are two groups that really would benefit from more support, more training. So that's been also the evolution that I've seen. So those are some of the trends that I've seen change over time.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. Very cool. It's good to know that there are people out there more and more every month, every year. It sounds like actually paying attention to this and working towards bringing people together with the ideas and all these different processes that help to improve it. It's kind of funny. I never really thought about, like the physical workplace hazards, being hunched over, leaned over, doing procedural things day in, day out as being part of that wellness. It certainly is evolving rapidly. I mean, are there still any common misconceptions, any common thoughts still going around, vestigial remnants of how people think about wellness versus burnout that you encounter commonly even today?
Yeah. Well, I think some physicians or anyone really in healthcare may react to physician wellness as something that's really fluffy. And really, it's changed, right? We're now talking about wellness as something that is research, something that is measurable, something that involves tactics and strategies. So I think it's very different than the way it was once perceived. But one misconception, I think, to clarify, is that it isn't a deficit in resiliency. And I think that's how people perceived it at first, that it was the physician's fault, that somehow they were just not resilient enough to do the job they were supposed to do, right? And it's quite the opposite. I think physicians, learners in medicine and in healthcare are very resilient individuals. It's that you can be both. You can be very resilient, but also burned out. You can also be exhausted, or you can suffer from a mental health condition, but also be very resilient. So, and also I've noticed a bit of a fatigue around the word resiliency. And so I think it's probably better to focus on health and safety, well-being, fulfillment. But that is something important. There's no deficit here in resiliency. We need to change the work conditions or the workplace. We talked again about the idea that physician wellness really should be thought about as an occupational hazard, as something that really derives from the workplace. One of the worries I've had through my work in wellness is a worry that because we're adding curriculum and courses on wellness, let's say in med school, which is great, we need to prepare our learners to understand, the risks, how to start preparing, how to prevent stress from affecting you. The worry I have is that we then set them up to go into the clinical world, the real world of medicine, and then all of a sudden they are put in a highly competitive, highly stressful and demanding environment where there's a lack of resources, pressure, to do a lot of work. Workload is huge. And I think that's a shock to them, that everything we've taught them about, hey, set boundaries, take care of yourself, sleep better, that just is not always realistic in the clinical world as we stand. So there's a bit of a divide there, but that is changing. It is improving. And I think it may take a few generations until we actually see the kind of health and wellness really get into the clinical environment. So I sometimes worry about that, about the message we're giving the trainees, but still we need to do it. They need to know the reality of what it's like to work in medicine. The other thing I worry about too, as we're including more wellness leaders into organizations and leadership structures, I think it's fantastic and it's needed. We need to have someone representing wellness at the table, at the leadership table when there are important discussions happening. But the concern I have is that it's a gesture more of tokenism that, because the challenge is when it comes down to budget, when it comes to the bottom line, to problems with the OR, to lack of resources. It's really difficult for the person representing wellness to influence those operational and budget decisions. It's really hard. I mean, there's so much pressure on healthcare organizations to do the work they need to do. So there's competing priorities. And so one can advocate for wellness at the leadership tables, but it's still a struggle to actually have it translated into operational decisions. But again, we're getting there. And that's why the buy-in of leaders, the training of leaders is what's going to actually lead to true change within the hospitals. And maybe the last word on that is, today we're talking about physician wellness, but let's be clear, really we're talking about workforce wellness, because all the pressures that physicians are under also affect everyone working in healthcare. And it's beyond the official professional groups. It's the porters, it's the people that help patients, it's people in nutrition, in health and safety or security. It's everyone working in healthcare that can be impacted by all of the stresses that we see. So I just wanted to make that point as well. It's important.
Well, it's interesting that you note, like just the concept of tokenism, of having the wellness officer or the wellness leader present at the table, but then it winds up coming down to just budgetary decisions and sort of a rock and a hard place there. What about on the other side of things, where, the relevance of just the medical culture itself, these things that might be, you mentioned, can change over generations and slowly shifting over time as we go through the years. What are those pieces of culture that you can see as being like important?
Well, when we think about physician wellness, we also think about how our profession of medicine is changing, and the culture, the professional culture, is also changing. And some have described different eras of medicine. In one description, there was before the 1900s, it was so awful to be a physician then that, in fact, suicide was understandable for a physician to consider, because there was very little treatment at the time. You may be the only doctor for miles and miles. So it was awful. But then there was this golden era of medicine, and from the 1900s to maybe 1970s, where there was an explosion of treatment options. And that's where the status of physicians changed. And there was much more prestige. And so to even consider suicide at that point was completely out of the norm. But then there was a change in the modern era afterwards, where we started saying, you know what, physicians are humans. They're not superheroes. So we need them to be more human, more vulnerable. Yet there was still the expectation that remained that physicians are still superhuman, and that they will continue to stretch themselves out and have no boundaries when it comes to the work. So that's one way to think about how the profession changes. But there have been really interesting articles recently from Tate Shanafelt in the US and his colleagues about the professional culture of medicine. And they're talking about well-being 1.0 and well-being 1.2 or 2.0 rather. And here are some of the shifts they describe, because I think they really hit it on the nail here. From like a godlike kind of position as a physician, we've now transitioned to only being a superhero or a hero, to essentially now being human, right? That's a positive change, and a human that has limits, a human that's vulnerable. So that's like one of the shifts that you see in those three types of eras. There's a change in terms of work-life balance, right? From being completely selfless and completely dedicated to your work life and to the profession, shifting in the middle to saying, well, let's have a better balance here, work-life balance, and probably pushed a bit by more women coming in to medicine, more young parents working and juggling. But balance wasn't necessarily the right word yet. Now we're really talking more about work-life integration. That's, the more appropriate term. And then perfectionism, right? Going from this view of perfectionism, not being able to ever make errors, we're now shifting to recognizing, hey, to err is human. let's try to prevent and speak more openly so that we can prevent errors, but also acknowledge them so that we can learn from our mistakes and not use shame and guilt. So there's been also a shift there, and just accepting in general that from this infallible physician that was invincible to now accepting again, we are human and like anyone else, we suffer, we are vulnerable to any kind of stress, infection, harm. And so we need to also practice more self compassion, more self care, putting that oxygen mask on. So those are principles now that we're seeing shift, and where it's coming up in our language, it's coming up in our philosophy. So those are just examples of some of the cultural shifts. And I have to say the younger generations of physicians are doing a great job at advocating and promoting those more current principles. So I think we really need to learn from them and be inspired by them.
I think the self-care piece, that's probably never going to go out of style, or at least I hope not. And it's really interesting to hear just how wild of a swing, that culture shift has taken over the years from, just being a terrible job to being the best job you can find. And then, okay, now the superhero complex side of things starts wearing off, and, the realities of burnout and overworking and work-life balance all start to kick in. And then even more so, when you think about it on the global context, here in North America, it's still very that, kind of superhero role, very highly desirable job. But you go to other countries, Europe in many places, right? And it's less of that highly sought after, more of a, medium of the road paying job, and, seen more as just, civil servant type of duty. There's nothing super glamorous or glorious about it.
And can I add to that? We saw it shift really rapidly as well during the pandemic. If you remember early on in the pandemic, people were with their pots and pans at 7 p.m. to say thank you to not just physicians, the whole workforce, right, in healthcare. But very rapidly, when the pressures became bigger and bigger on the healthcare system, when it was harder for patients to be seen, access, right, to clinical services were just getting harder and harder. And that anger quickly shifted the view of physicians from superhero really way down, and it eroded a lot of trust, which I think is unfortunate, and that we need to continue to work with patients to rebuild it. But you can see again how perceptions of physicians can rapidly shift according to the circumstances that we're finding ourselves in.
And so, what kind of things should those physician leaders, or people of any healthcare denomination and our allied healthcare team members, what should those in that position of leadership really be considering or implementing, or making sure they're walking the walk themselves? What kind of tips or tricks do you have there?
Well, and this is partly based on my own experience over a decade ago at the Ottawa Hospital. Um, where, I would say for any group or any organization that just is looking for a place to start to improve physician wellness at their site, and as you've said before, to expand some of those principles for all staff as well, I would say the first step is leadership buy-in. You need the leaders to say, yes, this is important to us. We're willing to invest and put time and energy into this. And then for leaders to designate an individual, someone who's passionate, who's interested in making a difference in physician wellness. So you identify a person to take this on. And that can be, a half day per week. Hopefully they're given protective time. Sometimes they start off volunteering, but essentially they require and really deserve some type of compensation or protected time to do the work because it's so important. That assigned physician wellness leader or champion can then form a committee with representation from across the hospital, from different departments, and ideally a committee that's diverse. And from there, what you do is you identify what are the key pain points that are really affecting physician morale, physician wellness. And that's how you can identify a set of maybe your top 3 or top 5 areas where you should try to improve things or focus your initiatives. And a lot of the times when you ask physicians, like, what could be better or what can make your wellness better, they'll say, just make it easier for me. to come and do my job at work, for me to be here to give good patient care, make my job easier. So when we surveyed our physicians at the Ottawa Hospital 10 years ago, they said, hey, if you gave me on-site access to a family doc, if you provided childcare for me, if I had better access to nutritious food, and if I could have maybe access to an exercise facility, that would really enhance my wellness. So they weren't asking for more counseling or psychology services. They were basically saying, make my work life healthier and better, and I will be able to feel better and provide better patient care. So what it did is it gave us a place to start as a committee and a place to start in terms of advocacy and building initiatives. So we created a strategic plan focused on those 5 areas with some outcomes, with who was the most responsible person. And that's how we got to work. And we could not have done that without the full support and some funding from leadership, because it'll be great. Like, you can have the best ideas in the world, but unless you have some funding, a little budget, support from leadership, you're not going to go as far as you'd like. And involving the communications department was also really important to really make sure that everyone had easy access to information, to tools and supports in a website, for example, or whenever we have a letter coming from our CEO or our chief of staff, they blend in a component of wellness. So that's been really effective. So those are some of the steps. And you cannot forget measurement. You need to be able to track the impact on wellness, which is really the reason you're working. So choose whatever measure works for you or meets your needs or your goals in your organizations. There are many measures, there's pros and cons, but it's up to you just to choose some, but then to repeat them on a regular basis. And we've done that. We went through an EMR implementation. We went through the pandemic, and we were able to follow at the hospital the pulse measure of all the staff. So that's been really helpful. So those are kind of as an organization, some of the approach that you can take. But if you're thinking of like that system level change, I can share with you some work that we've been doing at the Canadian Medical Association, again, with a different lens. But
please, yeah.
Yeah. Some of and again, we're trying to move through our Impact 2040 strategic plan. We're really about moving to action and having impact. So 2 key initiatives that we've been working on that are directly linked to physician wellness would include our work around trying to develop a pan-Canadian approach to wellness, but from a physical, a psychological, and a cultural safety perspective. So we're addressing wellness, but through the lens of safety. And we've now done a learning phase, an engagement phase to try to figure out what is psychological safety, what is cultural safety, what is physical safety. And in our conversation, Jordan, we were just saying like, wow, who knew that physical safety was more than just the biohazards that you have in your hospital? We all have to do training every year to be aware and to prevent some of those physical injuries or biohazards, right? But we need to think about physical safety to now include fatigue, right? And fatigue, by the way, is a huge driver of burnout. Maybe not surprising. But what about the workplace violence that we've now seen increase in some work environments in healthcare, particularly emergency departments, right? That's important as part of physical safety. We've mentioned the importance of musculoskeletal injuries for those surgeons or obstetricians that have maybe injuries positional or with instruments that sometimes can lead to harm. So there's that whole piece that is linked and so important in physical safety. But psychological safety, there's been a bit more work in that area. It's evolving still, but there have been some standards. The Mental Health Commission of Canada have developed some standards to allow for psychological safety. And, we're working on a definition to really make it crisp, like what really is, what's it like for someone to feel psychologically safe in their medical environment. And part of it is just feeling like you are able to speak without fear of retaliation or being embarrassed, in your learning or training environment. So again, there's more work there. We need to adapt it to medicine. And then the last piece that's newer is cultural safety. What is that exactly? And we're trying to see it as more about identities, right? That no matter which identities that you feel you identify with, is respected, that you are seen for who you are as an individual, that you can be your authentic self at work. So again, we're trying to figure out what definition that is. But what's fascinating is that with all the groups that we've met, they agree safety is important. In fact, to be well, you need to have safety as a fundamental foundational layer, like Maslow's hierarchy of needs. You need that safety. So what does that look like in all our training and practice environments, Jordan? That's part of what we're trying to figure out. Is there an approach that or a roadmap everyone can take? How do we measure and capture that? How do we use standards or not? Or how do we make sure that there's accountability to make sure that everyone, including patients, are safe? So that's work that we've been doing at the CMA. The other really interesting initiative is improving wellness by decreasing administrative burden. Huge hot topic at the moment, right? That most docs can relate with. And the idea is to say, look, there's so many hours that are spent with unnecessary admin burden that we need to do something about that. So the CMA put together a working group to come up with key recommendations on the role, like what could CMA do to help improve this area. Family docs are hugely impacted by this, but it affects every physician in the end. But the recommendations that came out of the working group were some basic principles, like we need to always involve physicians in the code design or in solutions, right? That's so important. Involve us from the beginning. The idea of advocacy and really raising the level of awareness of this issue is really being one that interferes or that affects safety. But the key recommendations were about interoperability. So let's look at improving interoperability. So CMA is now involved on a task force to look at interoperability and make some recommendations for that area, right, in terms of data sharing and access to information. One other area is federal forms. So can we look at ways to either eliminate or simplify or delegate some of these national or federal forms, because they're very, very time consuming. And one of the most, the CPP disability, right, taking huge amounts of time that could be used for clinical care. So that's work that's being done. The other area is AI. How can we use AI safely? And what regulations would be used to apply AI as a solution, not to add more burden, but as a solution. And finally, sick notes. Like, is there legislation that we can come up with and advocate for that will either eliminate or reduce sick notes? Because again, that takes up a huge amount of valuable clinical time. So what's super interesting is that based on work from Nova Scotia, CFIB shared a report where they used the Nova Scotia results and expanded them at the national level to say, hey, unnecessary admin burden was costing like 18.5 million hours per year of physician time. And that equates to like 55 million visits. And so we need to improve admin burden to free up some of the time, not only for more access to care for patients, but also for physicians to be able to take care of themselves. We're talking about that work-life balance, or to invest in professional development, or to continue working on more solutions to reduce admin burden even more with their team. So that's something that's a bit, again, it's more tangible. This is meant to be impactful. And so the work is ongoing and will continue over the next year or so. So I look forward to seeing what impact that's going to have. The other work CMA is doing is on human resource planning and just saying, what can we improve in our regulatory processes to make it easier for locums, right, to go to different provinces. So pan-Canadian licensure has been an area of focus as well for the CMA. And for us, measurement, we've talked about the National Physician Health Survey. It is very important to us to continue having that pulse of Canadian physicians and learners. And what's really unique, I think, about the surveys that we create is that it's not just measuring the prevalence of health outcomes, but it's linking them to some of the drivers of wellness, whether it's work conditions, work environment, whether it's the professional culture, psych safety. So we're really trying to stay current and relevant for what's going on at that time and make many links as we can, because then that means that we're pointed towards the pain points and the drivers so we can actually work on true solutions. So The last piece I'll say is that through a lever of funding, we've really tried to work with partners to make a difference. And I have to highlight and I have huge gratitude for the Affinity partnership or agreement, which is an agreement between the CMA, but Scotiabank and MD Management. And in that agreement, they committed $115 million to support physicians with a particular focus on physician wellness. So up to date, and it's higher than this, but there's been over $74 million spent specifically towards physician wellness initiatives. And I'll highlight some examples. Like they did early on, gave a little bit of money specifically to physician health programs. The pandemic then came. There was a helpline that was created to ensure that all Canadian physicians, learners, and their families had access to a wellness line during the 2 years of the pandemic. So that was funded through Affinity. They're funding some of our conferences, like the Canadian Conference on Physician Health, which we just had this fall in Montreal, and now we're co-hosting the upcoming International Conference on Physician Health. This will be in Halifax in October. Super exciting to be co-hosting with the American Medical Association and the British Medical Association. But most recently, the Affinity funding was directed to create grants to improve or reduce administrative burden. So this was the Healthcare Unburdened Grants. We're still waiting for to hear the winners of the grant, but that was another way that the funding lever, and specifically Affinity, is really working to make change. And the other piece that Affinity did is it funded a whole gamut of what we called Physician Wellness Plus initiatives across the country as pilots over 4 years to see, hey, what can be innovative, what can work, what can make a difference and be scaled up. So funding has certainly been one of the levers that the CMA has used to make a difference in physician wellness. And so with some of these projects, our physician wellness and medical culture team continues to advocate. We continue to post on we have a CMA.ca wellness hub where we've posted a whole bunch of curated resources and articles, either for individual physicians, but also for the physician leader, like someone that's a newly appointed physician champion can look in that section to find specific articles that may help them, like the ones that we've talked about today in the podcast, Jordan. But there's also resources leading you directly to the physician health program in your province. So, making some of the resources more easily accessible is one of our mandates as well in our team. And convening. I mean, it's so important for us to link up and connect with other groups and associations that want to make a difference. So we have regular meetings with our physician health programs. We have regular meetings with groups like the Royal College, AFMC, CFPC. And I'm involved also in a working group as part of the CanMeds 2025 revamp. So really making sure that there is some work in there around wellness, around safety, around physician as human, and recognizing what we bring in when we decide to join the workforce in healthcare. So really great opportunities for us because we can't do it alone. We need to work as partners and collaborate together really to make a difference. So a lot of work still to come for the physician health and wellness team at the CMA.
So a lot of things in there, very, very heterogeneous. I'm going to try and sum it up, but it boils down to having leadership that is responsive to feedback, or at least having somebody asking questions. And it doesn't really matter what level that's at, whether it's the Canadian Medical Association seeking feedback across the board, and the feedback being admin burden, and then mobilizing resources to alleviate that, or even like a large employer or a hospital where childcare winds up being the feedback to facilitate being a more effective employee and parent all at the same time, all the way down to within departments or teams where identities and culture are respected. But it seems like just having somebody at least acknowledging that there needs to be the question asked of what is the feedback, how is everybody doing, what are some of these common trends at any level, in the spectrum of just how can we do better? How can we make everyone feel more respected, appreciated, and happy?
Absolutely. And when you think about it, that approach is consistent with the quality improvement approach, right? That methodology using PDSA cycles to say, look, try something, measure it, go back, adapt, get the feedback. So I think that's a rigorous approach. But at the end of the day, what we need, and you just said it, Jordan, we need more communication. We need the community to pull together. We need presence. You know what helped the most during the pandemic is leaders just walking down into the emergency rooms, into the ICUs to say, you know what, I see you. I'm seeing the work you're putting in. I see the stress you're under. I get it. I understand. I'm here for you. I can at least listen to you and try to help. So I think you're so right about the importance of not just listening, but truly being there, being present, listening, being receptive, and then just being candid about what you can or can't do at that very moment. But there's a lot of emphasis right now on communication, on respect, and on team-based care. I really think there's something about working together in groups that is protective for wellness and enhances wellness. So that those are all important points.
And then to end off the podcast, I ask this to every guest, and I'm kind of excited to get it straight from the VP of medical wellness and physician. What is your personal routine? You know, we're trying to move away from the word resiliency, but how do you build that capacity within yourself as an individual? What does that wellness cornerstone look like for you?
Ooh. So I'd say two things. I need variability in my life, and I do need to replenish myself in areas that are completely out of medicine. So variability for me meant not just doing clinical care. Along the way, I was also teaching. I do a little bit of research. I'm not a researcher by all means, but I like to dabble or participate in it. But I've loved my work in administration and leadership because of the potential for innovation, for creating, for being an underdog, and just advocating for some of the newer or tougher issues. So the mix of the type of work that we're able to do in medicine, I think, has been one of the things that feeds into my wellness. But variability also in the way I work. I do some virtual work, but I also do work within the hospital. So that helps, right? You shake up the environments. In my personal life, I need to go out to our cottage, into the country, and just look at the stars, listen to the birds, be connected with nature. So I need some city, but I also need some country life. Family time is important. But here's one thing that I've done recently that has really been great for my wellness. I joined, it's a choir for female physicians. It's based in Ottawa. And to me, giving myself a very different challenge, so it makes my brain work in different ways, and connecting with colleagues and peers. So it adds a social component. That has been the best thing that I've done for myself this year that's fed into my wellness, aside from, again, active lifestyle and doing all those, the core, lifestyle things. So music has been really important, social connection. But I have to say, and I'm so grateful, like actually practicing gratitude is probably my biggest tool. But I'm so blessed with doing work that's so meaningful and fulfilling to me. And that's the one tip and my hope for anyone here in medicine or abroad. If you're able to do something that is meaningful for you and that gives you joy and fulfillment, that can go a long way in really giving you a sense of wellness. So to me, I've been blessed in that area. I'm very, very grateful. So I hope that gives you a bit of a sense. Jordan, humor, self-deprecating humor, always important for me. Good Netflix series, good books. I think that's overall what helps me. But it's not always perfect. We all have our down days. We have our tough moments in life. That's normal. It's expected, but it's just getting through them and maybe growing stronger from them.
Amazing. Well, thank you for sharing that. And thank you so much for joining us, Dr. Carolyn Gérin-Lajoie, Thank you again for taking the time this afternoon.
It's been a pleasure. Thank you so much for giving this topic some space, and all the best.